Okay, welcome everyone. We will go ahead and get started. We're so glad you're with us this afternoon. And again, this session is focusing on the UNC Adams School of Dentistry, and it's part of our Students at Work Healthcare Spotlight Day. And joining us this afternoon, we have Lamont Lowry, who is the Assistant Dean for Student Recruitment and Engagement for the UNC Adams School of Dentistry. And then presenting the presentation is our Amber Scott and Brenda Ransom. So I will go ahead and turn it over to them.
Good morning, everybody. I am Amber Scott. I am a second-year dental hygiene student here at the Adams School of Dentistry, and we're really excited to tell you all about some of the opportunities here. So who will be presenting with me is also Raina, and she'll introduce herself after me. So I actually graduated from UNC in 2020, and these pictures were from my graduation ceremony that had to happen in October since COVID kind of pushed out the real ceremony, sadly. But my situation's a little different because I graduated from a bachelor's program and then decided to go back for dental hygiene for 2 years. And so this picture in the middle is a picture of some of my classmates at our white coat ceremony. So I'll graduate again this May with my second bachelor's degree in dental hygiene. And then I'll let Raina introduce herself.
So good afternoon, everybody. So my name is Brenda Ransom. I'm a fourth-year dental student at the UNC Adams School of Dentistry. I graduated from Hampton University in 2018 with a Bachelor's of Science in Biology, and then began dental school that summer of 2018. And now I am finally in my fourth year, which is the best feeling in the whole wide world. But just a little bit about myself. So I'm originally from Northern Virginia, a town called Stafford. And currently I serve as the national president of the Student National Dental Association, which is an organization that works to promote and fight for the enrollment and matriculation of underrepresented minority students into dental schools across the country. So that has just always been something I've been very passionate about. And I'm truly honored to be able to serve in this role. And then I just have some pictures here of my undergrad institution, one of my best friends in dental school born, and my family. And then of course, what's getting me through dental school is Peloton workouts every morning. I always like to get my body moving in the morning so I can have enough energy to get through the day. So I can start just kind of talking about kind of the missions and values of our school. So the UNC Adams School of Dentistry is definitely a unique place. So we're thinking about total health when in terms of oral health, right? So your mouth is the opening to your body. It's one of the first things that, just an entrance point for all the other systems in your body. So one of our goals at UNC is to truly transform dentistry for better health, and also to become and to maintain our status as a global leader for oral health care education. And of course, to passionately serve as our people. As UNC, many of you know, is a state institution. We always have the fight and the mission to truly serve the people of North Carolina first and foremost. And we can go ahead to the next slide. So yeah, so dentistry is an amazing career, y'all. Like there's so many different ways and so many different facets you can be involved in dentistry. Amber will touch a little bit on dental hygiene and dental assisting, and I'll focus mostly on dentistry. But you guys can look at this list here. There's just so many different ways in which you can work as a dentist. So many people probably think of a dentist as someone in an office known as a private practice where you guys might go and receive your dental care. So that's just one of the many avenues that dentists can carry out their career. Dentists can also work in educational settings within dental schools to teach the next generation of dentists, and even dental residents who are becoming, general dentists or various specialists. Dentists can also work in public health clinics, treating the underserved. And there's a really cool aspect now, sports dentistry, which if you guys have seen, like, the LA Lakers or the Carolina Panthers or whoever, they all have a team dentist. So when things happen to their players, there's somebody there to take care of their needs immediately. And then also there's a huge need for dentists in the military. So that's another opportunity to, one, have your school totally financed for you, also a way to travel across the world and really just, treat people who are fighting for our country, and just see some amazing places.
Thank you, Raina. So I'll talk to y'all a little bit about dental assisting and dental hygiene. So I actually worked as an assistant over the summer, this past summer. So I got a little bit of experience in this area. So assisting is, your responsibilities will include organizing, cleaning, and maintaining equipment in the dental office. Sometimes you'll help record vitals and history, like charting. And then you will learn how to take and develop x-rays. And assisting, usually you'll have to go to school for 9 to 11 months to complete a program. And I listed the salary here. Obviously that can fluctuate a little bit. Assistants will also assist the dentist with dental procedures as well. You can move on to the next slide. So now I'll move into talking about dental hygiene, which is what I will be graduating and doing in the spring. So some skills that you'll need as a hygienist is attention to detail. You have to have really good communication and teamwork, especially since you'll be working with assistants and dentists. You're all kind of providers that will have to communicate about a patient's treatment. You'll need to have critical thinking and problem solving. You'll have to co-diagnose with the dentist. Dexterity. So you need to, I'm kind of clumsy, I'll say, but I try to practice with my hand skills. So you can definitely practice and get better. And then you have to just have a love for science and education. Also just teaching your patients how to take better care of their health and oral health. So a lot of people wonder about men or guys in the hygiene field. And while it's still, the numbers are kind of low, they are rising. We actually have one of our classmates is a male, and I think it's kind of like a field of nursing where it's, it's working towards, building more diversity in the field. And so if you're interested, I would definitely think about it, because there's definitely a trend in growing of men in the field. All right, and you can move to the next slide. So this is kind of the timeline for dental hygiene. So you can either do an associate's or a bachelor's degree. Associate's is 2 years, but a bachelor's you'll have to do a couple years of prereqs before you can move into the 2-year program. So I decided to do the bachelor's degree because, like I said, I went ahead and did all of my prerequisites. So I got a full bachelor's degree. And then my thought was, I have all of my prerequisites. I'll go ahead and do 2 more years. So I'll get 2 bachelor's degrees. But so you can decide between either associates or bachelor's, and either one is valid. And then you'll complete your prerequisites. And if you decide to do the bachelor's and go into dental hygiene, the program will be 2 years. So there's some advantages of becoming a dental hygienist. Obviously, you get to help people and make an impact in your community, and you can educate your patients. But it's not limited to, like Raina said, there's plenty of other opportunities other than just private practice. You can work in clinical hygiene, which is where you'll be in a practice setting with a dentist and dental assistants and see patients. You can also do public health, which is really rewarding, I think. You get to work with communities that are a little more vulnerable and that might not have the advantage of going to see a dentist regularly. You can be an educator, so you can work at a school or an institution and be a faculty and kind of teach people the skills that you need to become a dental hygienist. Advocate, you're always advocating for your patients and better oral health. And you can also work in administration in the institutions and clinics as well, be someone who oversees a program. And then there is also opportunities for research and corporate, so you can sell products relating to oral hygiene. All right. I'll
Awesome.
turn it over to Raina to talk about the life of a dentist.
Thanks, Amber. So when I tried to think of how exactly to explain the life of a dentist, I thought it would be a cool way to explain it kind of in the framework of how we're taught at UNC. So our school has three main pillars that they use to teach all the students, which is clinician, advocate, and thinker. And these are kind of the three major aspects of what it takes to be a dentist. Okay, so for the clinician part, of course, like as a dentist, you're going to be doing clinical procedures. I always tell people when they come to dental school, Amber kind of mentioned about, the manual dexterity. You always have to give yourself grace at dental school because you're learning a surgical skill at the same time you're in school. So there's different ways to practice that. You can sew, cross stitch, knit, like anything that has like fine motor skills, braiding hair, doing nails, like all of those things will help to improve those skills. But back to the day of life of the dentist is we'll be doing all different types of procedures. So that includes fillings or restorations, extractions, crowns, which is sometimes when they go around the tooth and put like a cap on top of it. And then even dentures or even placing implants. Those are the, and there's thousands of more procedures that a dentist can do in a day. But that's just one layer of the job. The next layer is being an advocate. So as an advocate, you're not only an advocate for your patients, but you're also an advocate for your support staff. You have to make sure you always have your team's back during the day and within the office, and also making sure that all of your patients are getting exactly what they need. As a general dentist, you're going to kind of be like the quarterback on a football team. So you're the one who determines what the treatment needs are for your patient, and then you make sure that your patients get to the appropriate person, if you can't personally provide that service to them, to find how they can get those services within other members of within the field, within your community. Sometimes you have to reach out to other dental specialists. Sometimes you may have to reach out to other people in the community, like social workers, people who do different types of programs that enable your patients to get the most ultimate of care. And then, of course, dentists are always required to be thinkers. You're constantly thinking of which treatment option would work for this patient best. In school, you learn so many different things and so many ways to treat a tooth, but there's always things that present differently than how it presented in a textbook, right? Or how it presented in your simulation lab. So you have to use all of that knowledge that you've gained in dental school from that 4 years of education and the continuing education that you've completed since you've graduated to make the best decision for how to care for each individual patient. So basically, if you're going to be a dentist, guys, you're going to be on your toes every day, just looking in new situations, and no patient is the same, no restoration or filling is the same, no crown is the same, nothing is the same. So you're always going to be on your toes. Every day is going to be different, and you're going to be just trying to think of what's the best way I can make this person's smiles brighter, better, just have their oral health be tip-top shape. Then we can go to the next slide. Yeah, so I kind of talked about the day in the life, but now we'll talk about some of the advantages of being a dentist. So of course, whenever you're given the title of doctor, that I don't want to say elevates, but puts you in a situation where you now have a lot of responsibility, right? So too much is given, much is required, and you're now going to be a leader within your community because you have this title. So you have to be smart in your decisions to make sure you carry yourself in a certain way, to really just be a leader in your community. But of course, like we mentioned previously, you're really going to help people maintain their oral health. And I don't think even this part of the profession has clicked with me as much until I'm now outside of school doing my external rotation. And when you see people who are in an area who might not have access to care as routinely as you or I may do in whatever setting you live in, but you can truly see that even how dental cleaning can change someone's life, or it can just change the way they carry themselves. And it can just be a tool to really educate them on how to better care for their oral health. And as high schoolers, you don't think about losing all your teeth, but having teeth is so important, and doing everything you can to help people save those teeth, it's really life-changing. And then like we mentioned before, you can work in a variety of different environments. So every day will be different, and no situation will ever be the same. We can go ahead to the next slide. Okay, so just a little bit of what it takes and to pursue any career in dentistry, whether that be dental assisting, dental hygiene, or being a dentist, is going to take passion to help others. You always have to remember why you are setting out on this path. And as long as you're setting out on the path in order to, be a leader in your community, help others, and, pay it forward, then you have the great intention. Of course, you want to have an interest in the sciences because everything that we do, especially how we're taught at UNC, is always going to be evidence-based. So we want to see the research that validates the procedures that we're doing. You also want to have great attention to detail, great communication skills, like I mentioned earlier, leadership, a positive attitude, and again, that mental fortitude to keep pushing forward when things get difficult. So a little bit of a timeline for dental school. It's a long road, y'all. I'm not going to sugarcoat you. It's a long road, but you can do it. You just take it step by step, piece by piece. So if you're interested in dentistry and you guys are in high school, right, in middle school even, you guys can start right now by starting to just get your community service hours and shadowing, finding a local dentist in your community, maybe reach out to them, see if you can come into their office and talk to them to find out more about the profession. Then, of course, once you get into college, you need to complete those necessary prerequisite courses. It's always important to look at the schools you might be interested in to make sure if they have any special classes they want you to take. But for the most part, it's like biology with lab, a chemistry class with a lab, organic chemistry, physics, and biochemistry are usually the usual ones you need to have taken in college. So you can major in anything. I chose to major in biology because that's what I liked. And it already had all the prereqs built into the major. But some people in my class, one girl in my class majored in art history in undergrad, and she still is in dental school. Then you have to take the dental admissions test, or the DAT, which will kind of get you set for, it's like the MCAT if you're going to medical school, but it's basically just an exam that tests your basic sciences abilities. And it has like a perceptual ability test as well that can help you, or dental schools assess, if you're ready to start school. And I say ready because, tests are just, ugh. And then of course, you're going to apply to dental school. And so typically, if you go to dental school straight after you go to undergrad, which of course you don't have to, you want to apply kind of in that summer of your junior year. Whatever you want to do, you always want to apply the summer before. So if you want to start in 2023, then you apply in 2022, I think. Yes, it's like a whole year summer before you would start. And then some other cool things that they have our summer enrichment programs. So when I was in undergrad or in college, I did several summer enrichment programs to help to prepare me for dental school. So one would be the Medical Education Development Program, and this is housed at MED. So I put a little information on, it's housed at UNC. I put a little information about the MED program and put some pictures from when I was in the program. You guys can see like this whiteboard here. This is what we would do every night. We had so much information to study. We would just put it all on whiteboards, make sure we could learn all of it. But my MED cohort here, it's amazing because I would say like 90% of this group is in dental school, and a large percentage of them are in my class or at in dental school in their 4th years right now. And so it's amazing to think where we were in this picture and where we are now. All right, so Amber and I we talked a lot about dental school, but now we're gonna kind of put you guys to the test if you guys want to answer any questions. So these are some dental x-rays, and we'll have some slides of different x-rays. So the first one here, this radiograph is called a panoramic. So if you guys ever had a pan taken, it's like when you're standing up in that machine, you're holding on to these like monkey bar things, and this big thing goes around your head, right? So it scans all your teeth. So when we see like this, what do you guys think's going on here? Like, how old do you think this person is? Are they 35? Are they 25? Are they 10? How old do you think this person is? You could put your answer in the chat. Yeah, or mute, whatever's easier. Okay, so 8 years old, I see that answer. So yeah, so we can look, if we look at this person's teeth, we can see that they have both their primary teeth or baby teeth, and then we can see at the top here, or you guys probably can't see my cursor, but we can also see their adult teeth. So my guess that this person would be probably like 6 or 7 because they have their first molars. Those are permanent and everything else is still baby teeth. So that's how I can tell. And then you can go to the next slide. Okay, so this next slide, oh, we can go back one, sorry. So this slide here, again, we see a panoramic, but this time we can see way more information. So pans are really great for dentists because not only can we see what's going on in the teeth, but we can also see what's going on in the face. If there's any, broken bones, if there's any growths or anything or surrounding, that is going to cause issues for the patient. But one thing that maybe many of you in high school have experienced already or will experience is having your wisdom teeth removed. So that's the teeth all the way in the back there. Those are wisdom teeth. And when it's saying impacted, the ones on the bottom, you can see kind of they're covered a little bit. They're covered by bone. That's what we mean by impaction. So one profession that specializes in removing teeth is oral surgery, and that's a specialty of dentistry that you have to go to dental school for. Sometimes you have to go to a little bit of medical school for, and then you do a residency program. So it takes a long time, but it's a super rewarding job. All right, and so I'm sure a lot of people on this call have had braces before. So one cool thing about ortho or orthodontics is that orthodontics are just amazing, honestly, because they can take teeth that sometimes will be up here by your nose, put wires and cranks and everything on them and do all the physics necessary to bring them down into alignment. Now you have a beautiful smile. So orthodontics is another specialty of dentistry that you would go to undergrad, dental school, and then complete a 2 to 3 residency program after dental school to then become an orthodontist. Okay, and then this and close up of a pan also just kind of shows some of the different things that dentists can do, general dentists, any type of dentist. So we can see some fillings in the right side of the screen, and then these larger restorations here that you guys can see, those are crowns. So that's when we take a tooth, run a drill all the way around it and put a cap on top of it to keep it nice and protected. All right, so we included this final quote just to let you guys know and kind of push you guys forward on this journey. If this is something that you would like to pursue, that success is not failure and failure is not fatal. It's the courage to continue that counts. Because pursuing this journey, I'm telling you, there's going to be highs, there's going to be lows, there's going to be difficult moments. There's going to be moments you're like, why the heck did I do this? But in the end, it'll always pay off. And I'm even telling myself this as I have 64 days left until graduation. I'm definitely telling myself this to just keep pushing until the very end. All right, so like we talked about earlier, what is your why? So Amber and I will just kind of give some closing statements. If you want to go to the next slide.
So these are 2 organizations that are really important to me. I ultimately decided, I told you guys I got a bachelor's degree in global health before deciding to do hygiene. So I kind of tried a few different avenues, but really what drove me to this profession in this field is just the desire to help others. So if you see on the right side, it's this organization called Global Brigades, and we have a specific dental chapter here at UNC. So I went on my sophomore year, so it was a couple years ago in 2018, I think. We went to Honduras and we served an underserved community that we gave them, lessons on how to brush their teeth properly, because there's actually a proper way to brush and floss. And we just, made connections with this community. And the really nice thing about this program is that it's sustainable. So there's always going to be people there to help the community. And we kind of connect local dentists there to keep the program up. And it was just a really rewarding experience that kind of made me make my decision on, I really want to get into dentistry. And then on the left is a picture of our shack clinic. So my friend and I, me and Anna, were in charge of the hygiene students. So we'll coordinate and make sure we have enough volunteers. This clinic happens every Wednesday and it's completely free, which is very nice because anyone from the community can come in, get, regular cleanings, and they can get, if they're in pain, they can get their treatment needs fulfilled if they might not have the money to do that on their own or the resources. So I think both of these are really important, and I just encourage you, whatever field you go into, it just really try to make your mark and impact on the community. And the last thing I'll say about hygiene is it's not just cleaning people's teeth. It's not just, lecturing about you need to do this, you need to floss. It's really making a connection with your patient, and you see them, usually every 6 months. So you'll really form connections with people. So if that's something that interests you, I would definitely look into this field.
All right. And so I just included some pictures at the end as well. Similar to Amber, I also volunteer at one of the student-led clinics at the dental schools called the Unc Cares Clinic, and it's run by the Student National Dental Association. And that's always just an opportunity to give back. Like, giving back is probably the most important thing to do with whatever profession you do. Like, I always believe that people are given certain skills in life, to basically pay their rent back to the world for being here, right? So you got to use whatever skills you have and to just make the world a better place. So the final pictures I just put up here, just some things from undergrad graduation. And then the picture on the top here is some of my colleagues and we were going on a mission trip or service trip to Malawi, Africa, but unfortunately it got canceled because of COVID. But that's another amazing thing that UNC offers its students, is just chances to travel across the world to really learn more about your craft and also just give back to populations who are in need. And then on the right side of the screen, I have my dental school gang, that the people who just get me through on a day-to-day. So, and just a closing statement, if you guys, are interested in dentistry, whatever career you're interested in, I just encourage you to just, keep striving for excellence, keep striving to be the best that you can be. And no matter what challenges or obstacles you may face along that way, just make sure to keep pushing, because you'll make it. So yeah, so then our last page here, these are just a lot of different resources of people that you can reach out to find more out about dentistry. The American Dental Association, Student National Dental Association, as well as the National Dental Association, Illinois State Dental Society, and many of the other resources that you see here can all be an avenue to learn more information if you're interested about a career in dentistry. So I guess now we'll leave the floor open for questions.
Awesome. Thank you guys so much. If you have any questions, you can go ahead and drop those in the chat. We have one question. So what classes should you take in high school if you're interested in a career in dentistry?
So what I would say is, I think it will be kind of hard to tailor them exactly to dentistry, because I feel like your high school career is more laid out for you. But if your high school offers anything about dental assisting or hygiene that you can do in high school, because sometimes I know high schools will have associates programs that they're like affiliated with, you should do that. But also, if you're interested in going to dental school, I would say just try to do the most upper level science class you can, and anything that will prepare you the best to be successful in college. So just take the most challenging courses available to you. So then when you get to college, you're like, oh, I got this. I already know how to study. I already know how to do all these things that I was doing in high school. And then when you get to dental school or hygiene school, whatever it may be, and you have to study really fast and a lot of information and spit it out really quickly, you're just ready to go.
And I'll add on to that. I actually was really lucky in my high school. We got to do this thing called intern or co-op, and I actually got to go out and intern at a dentist office, which is kind of where my interest sparked. So if you have anything like that, I recommend, anything that you're interested in, just intern and like shadow people. They won't mind. And then I will say, like, something that you wouldn't think about, take an art class, because like we were talking about, your dexterity, you can really work on, dentistry is an art. So you can work on like skills that we were talking about earlier with your hands.
Yeah, that's a really good point, Amber. Like art, knitting, anything that you're using your hands, even cosmetology would be helpful. And then I see the next question, as a dentist or hygienist are able to practice in different states. So yes, for dentistry and hygiene, you both take national board examinations that qualify you to work in all the states. But however, there are licensing exams that that are different for every state. So you have to check to see when you get your dental license or your dental hygiene license, which states take that license, and then you either move strategically to those states or you get a new license for the state that you're interested in moving in. And with that, I just wanted to say thanks for having me today. I do have to return to clinic, so I will be signing off now, but I wish you guys all the best of luck and throughout the rest of your journey.
Thank you so much, Rena.
Thank you. I'll add on to what she was saying. So hygienists do have pretty varying tasks that they're allowed to do in each state. So I think Colorado and a lot of states out west are a lot more progressive in letting hygienists do a lot more in their scope without, the direct supervision of the dentist. But we just got certified in North Carolina to do local anesthetic, which is giving injections to patients. So that's really exciting. I was like one of the first classes to learn how to do that. So we're moving up in the state.
That's awesome. We've got another question. Someone said, what type of personality should you have? So what personality traits stand out to you for dental?
I'll speak to that if I need to. Amber, you got it?
Yeah, I'll say a few things and then you can definitely add on. I think you just have to be really adaptable. Like you have to be able to, there's a lot of changes that happen kind of quickly, and you have to be a problem solver, and just having like a helpful and positive attitude, like with your team and your office and your patients. So I think you don't have to have one set personality. I mean, I've had people in my class that are like kind of shy. They don't love to talk a lot, but they kind of work through it and still find ways to connect with their patients.
Yeah, I'll add on as well. Sorry, my name is Mr. Lamont Lowry. I'm the Assistant Dean for Student Recruitment and Engagement here at UNC Adams School of Dentistry. And so we're looking for, as Amber said, certainly people that are adaptable and flexible. I often use this I tell this story about if I say we're going to Pizza Hut after class and we show up to Pizza Hut and the place is closed, I don't need you freaking out, right? We're going to go across the street to McDonald's and everything will be okay, right? So we're looking for students that really have that flexibility and that adaptability to be able to just go with it. Tests are giving electronically on the computer at dental school, right? Well, if the computer system's down, don't freak out. We're going to get a pen and paper and we're going to take the test, like we used to do in the olden days, so to speak. So certainly having a mindset to serve others is important as well. So I think there was a question about what is a typical weekly schedule of a hygienist or dentist. You can talk on that, Amber, and I can chime in if I need to.
Yeah, so actually the schedules are pretty different. For a hygienist, you're very much so your schedule kind of looks the same throughout the day. So for me, I kind of like predictability in my work. I mean, changes obviously do happen, but I like to master a skill and get really good at it. And then so I'm doing procedures where I'm teaching patients about their oral health. I'm doing scaling and I'm doing polishing. I'm sure you've gotten those done when you went to the dentist. And so I kind of like that predictability in my schedule. Whereas dentists, they'll have a bunch of different procedures. So they'll have like if you go into endodontics, you'll have root canals to do, you'll have fillings, you'll have to do crowns, you'll be looking at patients and they'll come in and they'll say, I have pain, and you have to kind of figure out what's going on. So the schedule can look very different, but I'll say for my schedule, I'll have like hour-long appointments in private practice, and I'll have about 4 patients in the morning and then 4 patients in the afternoon.
Yeah, I think you hit it pretty good there. I saw a question someone was asking about the annual salaries, and that was in the slide. So I'm trying to go back through the slide here on the side so I can see exactly what those numbers detail. Do you remember what the salary for dental hygienists annually was, Amber?
Yes. So on the slide, so this one says the median is around 75,000. But that definitely fluctuates. It depends on if you are starting out. Once you get more experience, your salary will increase. And it also depends on the skill set that you bring to the office. But I would say, typically if you're starting out, expect to make around 50,000 a year. And then it'll just increase from there as you gain more experience. And right now during COVID, demand for hygienists has actually really gone up. I'm always getting dentists and offices that'll be like, we really need hygienists right now. So as the demand goes up, I expect that the salary will go up as well. But we'll just have to see how the trends work.
And as a dentist, the salary, just really depends on, again, the area where you're working at. It can be anywhere from 125,000 to $400,000. It just depends where you are and what you're doing, whether or not you're a specialist or a general dentist. It just depends. So it varies. But I understand the question about salary because it's certainly important, right? But health service, health careers is about serving others. That's the top of it, right? And so we have to make sure that we're in the professions for the right reason. Yes, we all want to be paid. We all want to earn a healthy living. We all want the coins, the bag, whatever you call it nowadays, right? We all want that. But certainly we want to make sure that we're going into the profession for the right reason, because we can make all the money in the world and be miserable in that profession. And so we want to make sure that we're doing what we love. So hope that helped answer that question.
Awesome, thank you. Another question we have is for Amber. What have been the best and most challenging parts of your training so far?
I would say just the amount of information that you're trying to learn at one time. It can be a little overwhelming at first, but once you get the hang of it and really lean on your colleagues and your directors and professors, they all want you to succeed. So I think that the small knit community has helped me a lot and motivated me to just keep pushing through. And then I'll say the best and the worst part go together. So the worst part for me is just like grappling with health insurance, and I want to treat everyone, and it's just health insurance can kind of prevent some things from happening in the best way possible sometimes. But I think to combat that, just getting involved in community service like the free dental clinic at the school, it's really been rewarding to see that people that might not get their needs met somewhere, they can get them met, in the clinic here at the school.
That's a really great solution. Another question is, how is it different working with different age groups? And do you need a different skill set for the different age groups you're working with?
That's a really good question. So me personally, I love working with kids, but that's not the case for everyone. So there's definitely opportunities in both. So with pediatrics, I would say you even have to be more adaptable, just because it's so fast paced, and you have to be like a really comforting person, I would say, to the pediatric patients. And then as far as the older adults, there's just a little bit, you kind of have to have more conversations, whereas when you're with the kids, you have to like be a little more animated. And when we show them how to do things, you need to like actually show them and kind of like make it a little more of a production, I would say. But I think both, if you're any type of personality, can work with both. It's just you might have to work a little bit harder in one area than the other.
Yeah, everybody graduates as a general dentist when you go to dental school, and then you can decide to specialize whether or not you do pediatrics, as Amber mentioned, or some other specialty. But certainly as a general dentist, you can see kids, you can see the whole family, or you can just see adults, or it just depends on what you want to do in that profession. So yes, but having a heart for service, and certainly being patient if you're going to work with kids, having a patient approach and demeanor is very, very important, as well as whether we're working with special care patients as well. You have to have that kind of mindset of patience.
Awesome. Another person asked, how long is your workday usually?
So the workday for a dentist really is, generally dentists work 4 days a week, Monday through Thursday, generally 8 to 5, right? But it depends on whether or not you're a dentist as an associate or a dentist owner, right, of the practice. If you
Mhm.
own the practice, there's a lot of business stuff that has to happen. Dentistry is the fun part. That's why you go to school. But then there's that business side of it that has to take place. And so your hours may extend a little longer. And then it depends on too, if you're a dentist or a dental hygienist working on a patient, it depends how long the procedure takes, right? I mean, it could extend beyond the 45 minutes that you have allotted for it. So it just depends on when that particular patient's needs are met, and you can go home and sleep easy and not worry about that patient. Amber, I don't know if there was something you wanted to add to that or not.
I was just gonna say some practices will work Monday, Wednesday, Friday, or some will work Monday through Thursday, or some will even have half days on Friday or half days on Saturday. So it really just depends. As for me, like which office I join, or if you become a dentist, how you want to establish your office and how you want to run it.
And sorry, Jess, I had a follow-up question. You mentioned it's different between whether you're working as an associate or if you own the practice. Would you suggest people taking business courses if that's something that they wanted to do, if they wanted to start their own practice, taking those when they're in high school and college, taking those?
Absolutely. If you have an interest in owning your own practice, anytime you have opportunity to take some business classes, do that. Absolutely, because dental school will teach you practice management, but it's not a business school, right? So it's going to make sure that you know the dentistry aspect of it 100%. And now they're certainly obligated to teach you some practice management as well, but you're not going to get an MBA from the dental school, right? So it's important that you take some business classes if that's of interest to you, but know that have a thought process going in. Do I want to own my practice or not? And then when you shadow people, talk to them about the business side of it as well, so you can get a feel. Is that what you want? There are some people that want no part of the business owning it practice. They just want to show up and do what they do and then go home. Then others want all of that. So it just really depends on what it is that you individually are looking for. So shadow and observe and ask questions about all aspects of dentistry.
Awesome. And we are right at time. So I think we're going to go ahead and stop here. Thank you so much, Lamont and Amber, for joining us today. Just a reminder to everyone to please have your students fill out that feedback survey that we sent you. And if you have any questions later, just reach out to Robin and we can relay the questions back to you all. Thank you again for joining us. And I think that's the end of it.
Thank
Thank
you
y'all for having us.
Yep. Have a good day.
Bye.